So, what do you guys want to do today? I don't know, that diabetes group got their project done. You think we should get started for once?
Yeah, probably.
What do you think, Julia?
Friends episode is hilarious.
Ah,
Well, it would be a good idea for us to get our project started. I mean, we got like, what, 2 days left?
wait, what? 2 days only? So you mean we've wasted how many weeks?
Told you guys we should have started this a long time ago.
I knew it.
You knew what?
I knew I should have joined David's group.
Why?
Because they're done.
So?
So they're done.
Okay, I guess.
Okay, well I don't have all day to sit here with you guys and talk about doing it. So if we could just maybe do it so we can go home.
Yo, let's just get started right now.
Well, I really didn't tell you guys, but I do have something on my laptop that I completely forgot about. But I guess if we're gonna get started, we all could take a look at this, don't you think?
Yeah.
You guys ready? Yeah.
Let's do it.
All right.
Over 16,000 Canadians die each year as a result of a heart attack. There are an estimated 70,000 heart attacks each year in Canada. That's one heart attack every 7 minutes. Thanks to medical technology, most heart attacks can be successfully treated if immediate medical attention is provided. However, many delay, often attributing heart attack symptoms to indigestion, fatigue, or stress. Early diagnosis and treatment is crucial to saving lives. In this educational program, you will learn more about a heart attack, also known as myocardial infarction. You will discover its symptoms such as angina and who is most likely to develop it. You'll find out how angina and a heart attack are diagnosed, and the warning signs to look for in your everyday life. We'll also give you strategies for preventing and treating this common condition before it strikes.
I never thought I would have a heart attack. I thought I was very healthy. But then, one day, I had a heart attack.
Heart attack? I never thought I'd have one. I used to eat chicken, steaks, McDonald's. I didn't even exercise. And then one day I just woke up in the hospital. And that was a damn shame.
Angina is a condition involving temporary chest pain or a sensation of pressure that occurs while the heart muscle is not receiving enough oxygen. Typically, a person feels angina as a crushing sensation or an ache beneath the breastbone. This sensation is interpreted as heaviness or discomfort. Commonly, this pain radiates down one or both arms, up into the neck or jaw, or between the scapula and the back. Women experience this sensation differently from men, often feeling a burning sensation in the back, shoulders, arms, or jaw. Angina can be classified into 5 types. Nocturnal angina, which occurs at night or during sleep. Angina decubitus, which occurs when a person is lying down. Variant angina, which occurs at rest. And more commonly, stable and unstable angina. Stable angina is relatively predictable. The pain is triggered by activity or emotional stress. Unstable angina occurs without exertion and is less predictable, often displaying a change from the usual pattern, such as occurring at times of rest or coming on suddenly during activities that never caused problems before. Regardless of the type of angina you have, don't ignore it. Angina is a warning sign from your heart. Angina is your body's cry for help. See your doctor immediately for evaluation. Don't wait a few days or a few weeks for an appointment to address the symptoms.
There are three main coronary arteries which supply blood and oxygen to the muscle tissue of the heart, known as the myocardium. In order to adequately supply the heart with blood, the coronary blood vessels must be able to dilate and expand in circumference. As cholesterol and other fibrous tissue begins to line the wall of the coronary arteries, plaque begins to line and harden the vessels, creating a condition known as atherosclerosis. The atherosclerotic plaque has a negative effect on the proper functioning of the heart because it prevents the coronary arteries from dilating as they should, resulting in less blood flow and oxygen to the arteries. The atherosclerotic plaque may also become loose and cause a blockage in the coronary arteries, creating another problem that hinders the ability for the myocardial tissue to receive adequate blood flow. A lack of oxygen to the tissue is known as ischemia, and if the tissue of the myocardium goes an extended period of time without proper blood flow and oxygen, the myocardium tissue will change how it sustains itself. The change in how the myocardial tissue sustains itself is noted by an increase in acids within the tissue. It is the increase in acids which causes pain for the sufferer, and pain caused by angina usually only lasts approximately 3 to 5 minutes. If the sufferer of angina regains adequate blood flow, it is expected that there would be no permanent damage to the myocardial tissue. In myocardial infarction is the death of a tissue as a result of a lack of oxygen. Myocardial infarction is more commonly known as a heart attack. Blockage of the coronary artery leads to a reduction of blood flow to the area the artery supplies, and if the affected area does not have adequate blood flow, oxygen demands may not be met, resulting in ischemia and injury to the heart tissue, much like angina. Myocardial infarction differs from angina by how long the myocardium tissue is without oxygen. After approximately 15 minutes of ischemia as a result of inadequate blood flow, heart cells begin to die and the heart converts to a form of metabolism that does not require oxygen. The change in metabolism causes the heart to create more acids from the heart muscles. Myocardial cells are highly sensitive to an increase in acids. The increased production of acid creates an abnormal condition in the tissue. An abnormal level of acid in the heart muscle results in irregular heartbeats, an inability for the heart muscles to contract and pump blood as effectively as they once were able to. Once the tissue is infarct, it is permanently dead. But the damage to the surrounding tissue can be reversed if adequate blood flow is restored. It is expected that the area of dead tissue in the heart will expand within the first few hours of myocardial infarction, so it is important to receive medical care as soon as possible. Certain tissues in the heart will be permanently changed in a way that will cause them to not function normally as they once had, and changes to the tissue may continue for years after the heart attack. It is important to monitor the change in heart tissue as it could lead to heart failure in the future.
When the pattern of angina changes, becomes more frequent, lasts longer, or occurs at rest, your risk of a heart attack increases. The warning signs of a heart attack can vary. It's common to experience a combination of symptoms or no symptoms at all. Know the common symptoms of a heart attack. If you experience uncomfortable pressure, tightness, fullness, squeezing, or pain in the center of the chest, jaw pain, toothache, headache, shortness of breath, nausea, vomiting, sweating, pain that spreads to the shoulders, neck, or arms, or pain that lasts more than several hours, call for emergency medical help immediately. It could save your life. Women are less likely to get the right diagnosis and treatment than men. Part of this may be due to the fact that women are more likely than men to have atypical heart attack symptoms such as neck pain and shoulder pain, abdominal pain, nausea, vomiting, fatigue, and shortness of breath. Doctors have identified a list of risk factors that increase the chances of developing angina or a heart attack. This includes high blood pressure, high blood cholesterol, as cholesterol is the major component of plaque deposited in arterial walls, smoking, diabetes, and a family history of heart disease. Men over the age of 45 and women over the age of 55 are more susceptible to coronary artery disease and are at high risk of developing angina or a heart attack.
When Edwin presented to the ER, he was about 300 pounds above normal weight, and he was experiencing severe radiating chest pain which radiated into his arm. He was short of breath, sweating profusely, and complaining of stomach discomfort. These combination of symptoms led us to believe that Edwin may be experiencing a myocardial infarction, or a heart attack. With the possibility of this diagnosis, we immediately ran an ECG, an electrocardiogram, which records the electrical activity of the heart. Any abnormalities may be due to a heart attack, and areas of the heart that have been deprived of oxygen or have died can be identified. Blood tests are then run to check for cardiac enzymes. Cardiac enzymes are proteins that are released into the bloodstream by dying heart muscles. The enzymes that we check for specifically are creatine phosphokinase and troponin. High levels of these enzymes in the bloodstream indicate that a heart attack has occurred.
A chest X-ray may be performed to check the size of the heart and its blood vessels, as well as to determine if there is any fluid in the lungs, which can accumulate if the heart has been damaged. An angiogram, or coronary catheterization, is another procedure that is run to determine if coronary arteries are blocked or narrowed. It is performed by injecting a liquid dye into the arteries of the heart. This is done by inserting a catheter into an artery, often in the leg or groin, and running it through to the heart arteries. This dye is visible on X-rays, so it is clear which areas of the heart have been blocked. After an angiogram has been performed, the blockage may be treated by performing an angioplasty. Once again, the catheter is run through to the heart arteries. A balloon-tipped end that is inflated at the site of blockage compresses the atheroma and widens the artery. Once the artery is opened, a mesh tube called a stent can be placed in the artery to keep it open.
I didn't know I was at risk for a heart attack. I would do what I thought was living my life. I ate whatever I wanted. I was smoking since I was a teenager, and I was overweight. Didn't really get any exercise. But back then, I thought, who would really want to exercise? Little did I know, it was a recipe for disaster. But I started to experience chest pain, just below the sternum. But the funny thing was, I only experienced this chest pain when I was playing sports with my buddies. But then when I was resting, it would go away. So this left me in great curiosity. So I went to my doctors to get it checked out. And to my surprise, my doctor told me I was at risk for a heart attack. This really scared me. I didn't know what to do. So what he did, he prescribed me a nitroglycerin spray. What this spray does, it opens up the blood vessels, so it increases blood flow in the body, especially to my heart. So what I did was kept this spray on hand every time I exercised, just in case, my heart couldn't take the workload anymore. But now, I've changed up my lifestyle. I've gave up smoking. I've started to eat healthier foods. Less high-fatty foods, and no McDonald's. And I'm starting to exercise 4 to 5 times a week.
Remember, it is never too early to get diagnosed or to receive treatment. Act now. Recognize the signs and symptoms of a heart attack. Don't ignore the warning signs of your heart. It could save your life.